Cystic fibrosis is the most common fatal genetic disease today. It causes the body to produce a thick, sticky mucus that clogs the lungs, leading to infection, and blocks the pancreas, stopping digestive enzymes from reaching the intestines where they are required to digest food. Some physical symptoms a person with cystic fibrosis may have are chronic coughing, perhaps with phlegm or blood, inability to gain weight, and fatty poo, shortness of breath, cyanosis, and delayed puberty, among other symptoms. The chromosome that this genetic condition occurs on is the 7th chromosome, which contains over 1,500 genes. The gene that cystic fibrosis mutation occurs on is called the CFTR gene, cystic fibrosis transmembrane conductance regulator. The CFTR protein in the body, not chromosome, functions as a channel for movement of chloride ions in and out of cells, which is important for the salt and water balance of elliptical surfaces, such as lungs or pancreas. Changes in the CFTR gene can affect the structure of the CFTR protein in the body. Over 1,000 mutations have been described that affect the CFTR gene in different ways. The most common CFTR mutation is a deletion of 3 DNA nucleotides, which leads to deletion of amino acid known as femletide at position 508 of the protein sequence. This is denoted as delta 508 and is found in around 90% of cystic fibrosis patients, which is the cause for their disease. Cystic fibrosis runs in families in an autosomal recessive pattern, which means both copies of the genes received from the mother and father have mutations. In CF cases, each patient has one mutated gene and one normal gene, but if the normal gene dominates, the parent might never know they have the faulty gene and are potential carriers. A child only gets cystic fibrosis when the faulty gene from both parents is genetically passed down. Cystic fibrosis is diagnosed with a blood test, genetic test, and sweat test. The genetic test shows whether a person has faulty CFTR genes. The blood test shows whether a person's pancreas is working properly. If both these tests indicate cystic fibrosis, the doctor will conduct a sweat test, in which the doctor triggers sweating on a small patch of skin or arm or leg. He rubs the skin with a sweat-producing chemical and collects it on a pad to be analysed. High salt levels confirm a diagnosis of cystic fibrosis. There is no permanent cure for cystic fibrosis, but there is treatment to prolong. Chest therapy is a form of physical therapy that consists of pounding of the CF patient's chest to dislodge mucus. This can be done by hand or through devices such as an inflatable therapy chest. Doctors may also prescribe antibiotics, anti-inflammatory medicines, bronchodilators, or medicines to help clear the mucus. These medicines will help treat or prevent lung infections, reduce swelling and open up the airways, and thin the mucus. There is no permanent treatment for all variations of cystic fibrosis. There is currently a drug called Kalydeco, which is used to treat cystic fibrosis conditions that account for 4 to 5% of cystic fibrosis cases. This drug costs $300,000 per year and have many side effects, but the company who made the drug, Vertex, is currently developing a similar drug which will be compatible with a majority, 90% of cystic fibrosis patients. Cystic fibrosis funding is immensely important, as it is the most common life-threatening autosomal recessive disease among the people of European heritage. Although technically a rare disease, it affects a large number of over 70,000 people worldwide. This is much larger than disease such as Tay-Sachs or caravan disease.